everyone, welcome back to Pharma Palette. If you have ever looked at an ECG and wondered why some hearts beat too fast, too slow, and completely irregular, then you are in the right place. Arrhythmias can seem like a huge and confusing topic at first. There are different rhythms, different ECG patterns, and different treatment approaches. But don't worry, in this series, we are going to simplify everything step by step. So, today we will begin with the basics, what arrhythmias are, how they are classified, and the most important atrial arrhythmias like atrial fibrillation and atrial flutter. So, my goal is not just to help you memorize the facts, but to help you truly understand what's happening inside the heart. So, grab your notes and let's get started. So, let's start the topic with the definition. So, what is arrhythmias? Arrhythmias is simply the disturbance in the normal heart rhythm. That means that heart rhythm can be irregular sometimes. That heart rhythm can beat fastly. That can beat too slow. Like if the heart is beating too fast, that condition we call it as a tachycardia. Similarly, if the heart beats too slow, that condition we call it as a bradycardia. So simply we can define that if there is any disturbance in the normal heart rhythm, like if the heart is in the tachycardia or bradycardia condition, so that is called as arrhythmia. Now first let's try to understand the outline of this arrhythmias classification. Then we will be going with each one, like each condition in detail. So the arrhythmias are usually divided into three different classes. Like first thing is it is supraventricular arrhythmia. So that we can call it as SVA, supraventricular arrhythmia. And the second one is ventricular arrhythmias. Third one is bradyarrhythmias. In the supraventricular arrhythmias, these are further divided into atrial fibrillation, atrial flutter, and PSVT, which is simply paroxysmal supraventricular tachycardia. And the second class is ventricular arrhythmias. So here these are divided into PVCs. That means it is premature ventricular complexes. Premature ventricular complexes. Then VT means it is ventricular tachycardia. Then we have ventricular proarrhythmias. Then ventricular fibrillation. These four will come under the ventricular arrhythmias. Then the third class is bradyarrhythmias. So in the bradyarrhythmias, it is divided into sinus bradycardia and AV blocks. So in the AV blocks, you will be again having first degree AV block, second degree AV block, and third degree AV block. So out of all the three, the third degree one is the stage where there will be complete heart block. So coming back to the etiopathogenesis, the first one is supraventricular arrhythmias. In that, first type is atrial fibrillation. So atrial fibrillation is one of the most common conditions seen in the patients. And this atrial fibrillation is the sustained arrhythmia. So what do you mean by sustained arrhythmia? It means this will be lasting for the prolonged period. So this disease will be continuing for the prolonged period. So that's why it is the sustained arrhythmia. And coming back to its atrial rate, it will be 400 to 600 beats per minute. So in the atrial fibrillation, what happens? The atrias will be getting contracted in the chaotic manner. What do you mean by chaotic? Means it is irregular. So atrias will be getting contracted in the irregular manner. When this happens, there will be loss of atrial contraction. Now, what about the ventricles? So, here in this condition, the ventricular rhythm also becomes irregular. When the ventricular rhythm also gets irregular, it will be leading to the conditions like decreased cardiac output. It also increases the risk of thrombus formation and also it increases the risk of getting stroke. So these are the consequences occurring in this atrial fibrillation. Now let's see some of the causes which are leading to the atrial fibrillation. So in the causes, remember the code as HHDVL. That means H means it is hypertension. H means it is heart failure. D means it is dilated atria. V means it is valvular disease. L means it is lung disorders. So coming back to the second one is the atrial flutter. So in the atrial flutter, there will be rapid atrial activity. So what is rapid atrial activity? So atria means it is simply the upper chambers of the heart. So the upper chambers of the heart will be producing the electrical impulses very quickly. So that's why this atrial flutter will happen. So in this condition, the atrial rate will be 250 to 350 beats per minute. And coming back to the ventricular rhythm, in this condition, it is regular. The ventricular rhythm in atrial flutter is regular. And this atrial flutter is less common compared to the atrial fibrillation. Coming back to the third one, which is PSVT, which means paroxysmal supraventricular tachycardia. So what is PSVT? So when a patient gets this condition, that means there will be sudden onset and the termination of the tachycardia. Sudden onset and sudden termination of the tachycardia. So what do you mean by that? There will be sudden onset and sudden termination of the rapid heart rate. Coming back to its mechanism is that it is mainly caused by the re-entry circuits. And coming back to the various subtypes of this PSVT. So first one is AVNRT, which is AV nodal re-entrant tachycardia. Second one is AVRT, which is AV re-entrant tachycardia. Third one is SA nodal reentry. Fourth one is intra-atrial reentry. Simply, this PSVT condition is caused mainly because of these reentry circuits. The second part is ventricular arrhythmias. In that, first one is PVCs, which means premature ventricular complexes. So, coming back to its definition, first thing, what is PVCs? Simply, there will be ventricular beats, but they are early. So, early ventricular beats will be occurring before the next expected normal beat. Before the next normal beat, this ventricular beats will be occurring earlier. So that condition is called as PVCs. And what are the causes for this? First thing is the increase in the automaticity. Second one is any kind of triggers. So any kind of triggered activity. And the next one is any kind of re-entry mechanisms can also lead to this PVCs. So what is something that you need to remember clinically? So this PVCs are most commonly seen in the healthy individuals. So this can occur in the healthy individuals. Second thing is these are also more significant in case of structural heart disease patients. And the third one is if any patient has this frequent PVCs, they will be also having the risk of getting serious arrhythmias. There are some other high risk PVCs. One is multifocal PVCs and frequent PVCs. Coming back to the second one under this is ventricular tachycardia. So what is ventricular tachycardia? In this condition, you can see 3 or more consecutive PVCs. So consecutive means one after other. So 3 or more one after other PVCs will be obtained at a rate of 100 BPM. In this ventricular tachycardia condition, if you observe the ECG, you can see the QRS complex. That too, wide QRS complex tachycardia can be observed. And coming to the common causes, just remember the trick as HEMID, where H means it is hypoxia, E means it is electrolyte imbalance or electrolyte abnormalities, M means it is I means it is ischemic heart disease, and D means it is digoxin toxicity. So these are some common causes for getting this ventricular tachycardias. So this ventricular tachycardias are further divided into three different subclasses. So first one is sustained. Second one is non-sustained. Third one is incessant. So sustained means this will be lasting for more than 30 seconds. Non-sustained means this will be lasting for less than 30 seconds. Incessant means this will be occurring repeatedly and frequently. So coming back to the sustained ventricular tachycardia. So this sustained one will be requiring treatment, and non-sustained one, it can terminate spontaneously, and this incessant one, this will be becoming as a dominant rhythm. And coming back to some high risk conditions, so if the patient is having any kind of previous arrhythmias, or if he is having CAD condition or LV dysfunction, so these kind of patients are at a high risk of getting this ventricular tachycardia. So what is ventricular proarrhythmia? In this, an antiarrhythmic drug is responsible for developing a new arrhythmia. So that condition is called as ventricular proarrhythmia. And here you should also remember one thing. So class 1C antiarrhythmic drugs will be causing monomorphic ventricular tachycardia. And here we need to also discuss about one important condition, which is torsade D points. So this torsade D points is one of the special type of polymorphic ventricular tachycardia. So what happens in this torsade D points? There will be prolonged elevation of this QT interval in the ECG. So the QT level in the ECG will be increased. So that is torsade D points. So this can be inherited. This can also be drug induced sometimes. This can be associated with class 1A drugs and class 3 antiarrhythmic drugs. Like when this torsade D points will be occurring for a patient, first thing is you will be reducing the use of offending drug. Like because of which drug it is causing, you will identify and you will remove the drug. Next one is the ventricular fibrillation. So coming to the ventricular fibrillation, chaotic electrical activity in the ventricles will be seen. In ventricular fibrillation, chaotic activity of ventricles, that means irregular electrical activity in the ventricles can be seen. And in this condition, there is no cardiac output, there is no proper pumping of the blood. So this can sometimes also lead to cardiovascular collapse. And clinically, you need to remember that this ventricular fibrillation is one of the medical emergency condition, and this is the major cause for getting the sudden cardiac death also. And this is most commonly seen if the patient is having CAD or LV dysfunction. So coming back to the last type of arrhythmias is bradyarrhythmias. So in this condition, you know the subtypes under this. One is sinus bradycardia, and you have first degree, second degree and third degree AV blocks. In that, third degree is the one which is leading to the heart block. So you know till here. So in the bradyarrhythmias, what happens is the heart rate will be less than 60 beats per minute. And some causes for this is aging can be the factor, athletes or sinus node dysfunction, AV conduction disorders, and certain drugs are responsible for getting this bradyarrhythmias. So here you need to also know what is AV block. AV block is simply the interruption of the impulse conduction between the atrias and ventricles. So that condition is called as AV block. Now let's try to understand the symptoms under each type. In case of atrial fibrillation and atrial flutter, remember the trick as PD fast, where P means it is palpitations, D means it is dizziness, F means it is fatigue, A means it is air hunger, which means it is dyspnea condition. Then we have syncope. Syncope is a temporary loss of consciousness. Then T means it is tachycardia. And coming to the second condition, which is PSVT, so in this condition, remember the trick as RNC, where R means it is rapid palpitations, N means neck pounding sensation, C means it is chest pain or chest pressure. So next one is PVC. So remember the trick as skip and boom. Patient feels skipped beat and followed by strong heartbeat, and occasional palpitations will be seen. And coming to the fourth one, which is VT, that is remember the trick as LSPD, where L means it is low BP, S means it is syncope, P means it is palpitations, D means it is dizziness. And sometimes this can also progress to collapse. And the next one is proarrhythmias. So proarrhythmias are asymptomatic initially. Then the existing arrhythmias will be worsening sometimes. There will be chance of developing the new arrhythmias, and it can also cause sudden deaths. And the last one is bradyarrhythmia. So it's like a slow flow. Like first it will be entering into dizziness, then the syncope, then fatigue, confusion, hypotension. Finally, the heart failure worsens. So today we have built the foundation of arrhythmias by understanding their classification, atrial fibrillation, atrial flutter, and how patients commonly present their symptoms. So before you leave, ask yourself one question. Are the concepts becoming clearer? I know this topic can feel overwhelming in the beginning, but if you are understanding the logic behind these rhythms, you are already making excellent progress. So in the next video, we will move one step further. We will learn how these arrhythmias are diagnosed, what ECG findings to look for, and how clinicians decide on the initial treatment approach. And that's where the pieces really start connecting. So thank you for learning with me today. I will see you in the part 2. So if you found this video helpful, don't forget to like the video, share it with your study partner and subscribe to Pharma Palette.